Hello, it's Dr. Ade again, and today we're going to follow up on our discussion on polycystic ovarian syndrome. Now, we got to a diagnosis with the symptoms of raised BMI, hair in unwanted places in ladies, or the kind of male hormone effects of that, infrequent or non-existent periods or irregular periods, not starting it after puberty, that's also another symptom, and infertility. So those are the symptoms that we come across. Now, we've made a diagnosis based on this and we've done our blood tests. What do we do next? The most important, which I can't overemphasize, is actually lifestyle changes, which is managing your weight and watching what you eat. That actually can reverse quite a lot of the symptoms that we've described before. So if we can do that, that certainly helps. The next thing is metformin. I know you've heard of metformin before because we use it in treating diabetes, but we also use it in treating polycystic ovarian syndrome. It does help with ovulation in patients who are not ovulating. So it's very useful in that sense. Now, there are other things we tend to use, which is a combined oral contraceptive pill, which helps acne in patients with polycystic ovarian syndrome. So that is another option that you would be offered if you do have what we call hirsutism, which is hair in unwanted places for ladies. Please keep on it, because sometimes it can take up to 6 to 8 months for you to actually see the effect, but up to 60% to 80% of patients on it find it very effective. So please bear with us and keep using it. Now, beyond this, we're now talking about treating infertility. That's when we've referred the patient on. It is one of the reasons that causes infertility, but it's also one of the easier ones to treat as a cause of infertility. So I'll leave that to the obstetrician, the gynecologist and the obstetrician when they see you to discuss it. But what they're going to do is try and induce ovulation so that you can conceive. They try and do it naturally first, and only if that doesn't work do we go to things like IVF. But I'll leave that to the gynecologist to go through with you. All right, nice talking to you again. If you have any questions, please put it in the comments. If you have any topics you want me to discuss, I have a lot of time to do it. Please put it in the comments. Thank you very much. Nice talking to you. Bye-bye.